name is Sarah Lowther, and I am the Project Director here at the West Virginia Commission for the Deaf and Hard of Hearing. Welcome to Deaf Awareness Day. We're so glad you could join us. Normally, we hold this important event annually while the West Virginia Legislature is in session. Due to safety considerations, we are holding this event virtually this year. In this format, you can watch our video as many times as you'd like, as well as share with your friends and family from our Facebook page. Today, you will hear from many supporters and members of our deaf and hard of hearing community, including our governor, U.S. senators, members of the West Virginia Legislature, our cabinet secretary, our new executive director, and members of our board. Each person shares a message of importance related to West Virginia's deaf and hard of hearing community, providing support and services, and how to connect with others. Thank you so much for joining us for our first virtual Deaf Awareness Day.
Hi everyone, Senator Shelley Capito here, and I am sorry I could not be with you in person today, but I'm thrilled to be able to address you on such an important occasion. First, I'd like to send my warmest welcome to Erik Essington, who is beginning his tenure as the Executive Director of the West Virginia Commission for the Deaf and Hard of Hearing. The Commission has been incredibly influential in our state, and it has helped connect West Virginians with the resources they need to live life to the fullest. I look forward to working together to making West Virginia the best and most accessible place for those in the deaf and hard of hearing community. During my time serving in Congress, I've had the chance to meet with West Virginians who are experiencing hearing loss themselves, or have a loved one that is either deaf or hard of hearing. Because of their stories and insight, I've worked to introduce several pieces of legislation to expand access to hearing devices and services and make certain that quality education remains accessible to all children, despite the challenges that they face. I worked with my colleagues on both sides of the aisle to introduce the Alice Cogswell and Ann Sullivan Macy Act, otherwise known as Cogswell-Macy. This bill would strengthen the Individuals with Disabilities Education Act to ensure visual and hearing impaired students receive the best education possible. I've also been a strong advocate for a bill I introduced called Allie's Act that would ensure private insurance companies provide coverage for OCO integrated hearing devices like bone-anchored hearing aids and cochlear implants. Access to these resources is so important to the growth, development, and future success of West Virginians in the deaf and hard-to-hearing community. Please remember how important your perspective and experience is to my continued work in the U.S. Senate. Thank you for giving me the opportunity to be a part of Deaf Awareness Day, and I hope you have a fantastic day.
Hello, I'm United States Senator Joe Manchin, and I'm pleased to be able to join you all for the Deaf Awareness Day, hosted by the West Virginia Commission for the Deaf and Hard of Hearing. Ensuring our fellow West Virginians have the resources and access to quality care they need is one of my top priorities as your United States Senator. I'm fighting in Washington every day to protect the critical health care programs that West Virginians rely on and support the advancement and inclusion of all people. Raising awareness around the needs of all West Virginians is extremely vital, and the Commission's tireless efforts on behalf of many of our fellow West Virginians do not go unnoticed. I encourage all West Virginians to join me in celebrating and taking time to recognize Deaf Awareness Day in West Virginia. Thank you, and God bless you.
Hello everyone, I'm Gov Jim Justice, and today is a special day where I am putting out a proclamation recognizing a really important day, a day of deaf awareness. You know, if you'll just step back and just think, there's lots and lots of West Virginians that are struggling in a lot of different ways. But some way, somehow, from time to time, we forget just how important this day is, just how important in all the struggles that these people that are really struggling with hearing, you know, whether they be just very poor hearing or completely deaf, it is absolutely a struggle. And with all of that, we have folks that have really helped us in many ways. I thank Jennifer and I thank Julie. You know, really and truly. What great work they've done now for 2 years right at it, and everything to bring the message, to make sure that everyone absolutely understood what was going on with this terrible, terrible pandemic all the way through. They had to get this message to the right people. They sign and they absolutely do great work, and with all that, and they're absolutely, without question, my allies. You know, and I tease them about this all the time and everything, but how much better could they be? Not much. They have absolutely done great work, and I thank them in every way. So today, for those that are deaf and those that are struggling, we recognize you. We recognize you with the proclamation that we're not going to walk away. We're going to stand steadfast, and we're going to try to do any and everything we possibly can to help with the absolute struggle that you go through each and every day, and to make you, without any question, completely informed as everyone should be. So with that and everything, I congratulate you on this proclamation. I congratulate you on a great day, and absolutely it's an honor beyond belief to be your governor and to do good work in trying as best I possibly can to help all. So again, thanks Julie, thanks Jennifer. You know, no way we could have done it without you, and thanks to all those that are out there that are putting in the licks to help everyone. So this is the proclamation, and I'm not going to go through it and read it. To be perfectly honest, the print's too small for me to be able to see it. But nevertheless, thank you so much, and God bless each and every one of you.
Hi, my name's Delegate Laura Kimball, and I'm from Harrison County. I'm so pleased to take a few minutes with you to recognize Deaf Awareness Day. Our prayers remain with all the folks in Romney, and as they recover and they rebuild from last week's horrific fire. Our legislative session ends March the 12th, and I'm disappointed that a bill that I had sponsored to help improve the delivery of healthcare to West Virginia's deaf community has not passed, but I'll keep trying. This bill, House Bill 4772, would have required hospitals without an ASL interpreter on staff to provide the technology needed to allow for any hearing impaired or speech impaired patients and visitors to communicate. I hope you'll reach out to me anytime you have questions about what we're doing here at the legislature, or if you have any issues or ideas on how we can help you. Thank you again for letting me share this day with you, and I can't wait to see you next year at the Capitol.
Hello, everybody. My name is Mike Caputo. I'm a state senator, and I live in Marion County. I represent Marion and Montague counties. Thank you for allowing me to say a few words today on behalf of Deaf Awareness Day in West Virginia. I've been around the legislature for about 26 years now. This is only my second year in the Senate, but I served 24 years in the House. And I always looked so forward to when Delegate Rowan would bring the children down from the Romney School and they would perform for us. It was probably the most heart-touching day of the year because, as you know, sometimes down here things get a little crazy, things get a little stressful, and sometimes we even get a little mean to each other, but you know, that always brought everything to light, and it softened our hearts, and it made us all remember why we're here and what we're supposed to do, and that's take care of all West Virginians, all West Virginians. So, you know, I've always tried to be a part of that, and I've always tried to help on the legislative side, and if there's any bills that are of interest to this community, I want to be there. I want to not only sponsor them, I want to be your cheerleader, and I want to focus on them and try my best to get some things done. So I would also like to welcome Erik Essington. I hear he is coming here as the new executive director for the West Virginia Commission for the Deaf and Hard of Hearing. I hear he's from California, and some people may say, why would someone from California move to West Virginia? Well, that's only people who has never been to West Virginia, because once you come here, you're going to fall in love with our state, you're going to fall in love with our people, and you're going to want to stay. So Erik, welcome to West by God, Virginia. Please stop by my office and say hello to me. And I know this year is virtual due to COVID concerns, but hopefully we're all going to get through this. We'll do the best we can to protect ourselves, protect our families, protect each other, and hopefully next year we can all get together again live and in person. So thank you again for allowing me to be a part of this, and God bless each and every one of you. And let's have a successful day. And let's work hard. Let's work hard for all West Virginians, so everybody is on an equal playing field, regardless of who they are, where they come from, or what any disabilities may be. Thank you, and God bless.
Hello, I am Paul C. I'm the chairperson of the West Virginia Commission for the Deaf and Hard of Hearing Board. The mission for the Commission for the Deaf is to support for development and to keep general policy and to develop programs that support full and equal opportunities for people who are deaf and hard of hearing in West Virginia. The vision of the Commission for the Deaf and Hard of Hearing is to provide equal access and equality for those who are deaf and hard of hearing to all people in West Virginia. The Commission for the Deaf has been running for 33 years as of now, and we would like to introduce our 6th Executive Director, Dr. Erik Essington. We're so happy to have Erik and Sarah Lowther, the project director, to lead us in the commission. And I encourage you, the people of West Virginia, to be active in our events and be involved in opportunities for the deaf and hard of hearing for the people in West Virginia, all over the state. If you'd like to follow the activity of the Commission for the Deaf, you can follow us on Facebook, and you can visit our website. It's dhhr.wv.gov/WVDCHH. And welcome to our virtual Deaf Awareness Day. Thank you.
Hello, my name is Erik Essington. I have no name sign, just fingerspell, Erik. I'm the new Executive Director for the West Virginia Commission for the Deaf and Hard of Hearing. While it is bittersweet to leave California, my home for the past 50 years, where I have established my career as a hard of hearing person in developing and implementing services for the deaf and hard of hearing community. For the past 25 years, I have worked in the mental health and educational settings specializing in deaf services, where I've worked with state agencies, local community organizations to ensure that appropriate and accessible educational and clinical services are provided to the deaf and hard of hearing population. I hold a bachelor's in commercial recreation from California State University, Northridge, a master's in counseling and business, industry, and government from California State University, Northridge, a school counseling credential from National University, and last but not least, a PhD in clinical psychology from California Graduate Institute. I'm thankful for this opportunity to join the West Virginia Commission for the Deaf and Hard of Hearing. Though we can't be together today for our annual Deaf Awareness Day event, I look forward to coming together, whether it be virtual or in person, in the coming days and weeks ahead, and getting to know my fellow West Virginians. Starting today, I will be taking part in a listening tour of the deaf community, and I will be working with legislation, the Department of Education, Social Services, and community member to ensure that I capture multiple perspectives in my effort to lead through listening. There's much to learn, and I look forward in connecting with many of you on the opportunities as well as the challenges that lie ahead as we work together to facilitate a brighter and more equitable future for the deaf community here in West Virginia. I admire the strength and character of the people here. The impact that each of you, through your commitment, has had on the state is frankly unparalleled. And I look forward to writing our next chapter together as we turn to a new chapter in our journey to enhance the services for the deaf and hard of hearing. I look forward to meeting each one of you out in the community. Please, if you see me out in the community, approach me and introduce yourself. Thank you.
Hello, I'm going to tell you a story called Timber. A full bearded man wearing red and black plaid shirt, carrying a heavy axe on his shoulder and walking through the woods. He spotted a big, tall tree filled with leaves. "Wow," he said. He gets ready to chop the tree. Chop, 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 chop. He yells, "Timber!" And the tree falls down and hits the ground. He picks up his axe and kept walking through the woods, and he spotted another big tree. He starts to chop down the tree. Chop, 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 chop. And he yells, "Timber!" And the tree fell down on the ground. His stomach started to growl. "I'm starting to feel hungry. I'm going to sit there," he said. So he sat. He got out his lunch box and he opened it. As he eats his sandwich. He gasped when he spotted a huge, beautiful tree. He is in awe and he puts his lunch away. He puts the axe on his shoulder and started walking. He gets ready to chop again. Chop, 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 chop. He shouted, "Timber!" The tree still stands. I'm going to try this again. "Timber!" He yelled it louder. The tree's still standing. He gets his phone out and calls a tree doctor. The person he calls is a doctor. He's waiting on the doctor to come. "What's up?" asks the doctor. "Well, what's wrong with this tree?" "I'll try again," he said. "Timber!" The tree is standing. The doctor looks confused. "Let me check something," said the doctor. He takes a listen to the tree with his stethoscope. "Ah, he's deaf," answered the doctor. The bearded guy looked shocked. "Oh, I have an idea," he said. "Timber," and the tree fell down with a big and loud crash. What is Deaf Awareness Day? It's to spread the awareness of deafness and deaf culture, our beautiful language, and much more. Why do we sign? We're going to tell you why. To communicate with my friends, so I can communicate with deaf people. I'd like to communicate with my friends. It's our language. For communication, to have full accessibility. Happy Deaf Awareness Day. Happy Deaf Awareness Day. Happy Deaf Awareness Day. And Happy Deaf Awareness Day. Happy Deaf Awareness Day. Happy Deaf Awareness Day. Happy Deaf Awareness Day.
Hi, my name is Gwen Bryant. I have 3 amazing sons, the youngest of which was identified as profoundly deaf at birth. I currently serve as the parent representative for the West Virginia Commission for the Deaf and Hard of Hearing, providing a family perspective and parent voice on commission projects, activities, and community concerns. I'm also the director of the Newborn Hearing Screening Program, NHS. NHS is a legislatively mandated program administered by the West Virginia Department of Health and Human Resources under the Bureau for Public Health and housed in the Office of Maternal, Child, and Family Health. NHS is responsible for developing and maintaining an integrated statewide early hearing detection intervention, commonly referred to as EDI, system of services based on the Joint Committee on Infant Hearing recommended best practices on screening, identification, audiological, medical, and educational management of infants and young children and their families. NHS works collaboratively with EDI system partners, the West Virginia Birth Score Office, birthing facilities, audiologists, physicians, early intervention programs, and family-based support organizations to ensure that hearing loss is identified as early as possible to maximize the outcomes for all deaf and hard of hearing infants and young children in West Virginia. The Newborn Hearing Screening Program mission is to ensure all West Virginia infants receive identification and intervention services according to the JCIH, Joint Committee on Infant Hearing 136 guidelines. 1. All infants are screened for hearing loss by 1 month of age. 3. All infants that fail the screening receive an audiological diagnostic evaluation by 3 months of age. And 6. All infants that are identified as deaf or hard of hearing are enrolled in early intervention by 6 months of age. We strive to ensure that all families receive comprehensive, unbiased, and culturally competent information on programs, communication options, and resources for deaf and hard of hearing infants and young children. We also ensure all families of infants who pass their newborn hearing screening receive education on risk factors for late onset or progressive hearing loss and the importance of monitoring speech and language developmental milestones. Activities, projects, and trainings implemented to meet the NHS mission include tracking and follow-up for all referrals from hospital screening programs for infants that failed or missed their initial newborn hearing screening through direct outreach to families, physicians, and audiologists, such as phone calls, physician fax-back forms, and mailings. Referring all families with infants identified as deaf or hard of hearing to children with special health care needs, a statewide program that provides specialized medical care for children who have certain chronic disabling medical conditions and who meet eligibility requirements. To West Virginia Birth to 3 early intervention, a statewide system of services and supports for children under the age of 3 who have a delay in their development or may be at risk of having a delay and their family. To West Virginia Hands and Voices, a nonprofit parent-driven organization dedicated to supporting families and their children who are deaf or hard of hearing without bias towards communication modality or methodology. We maintain an up-to-date NHS pediatric audiological service provider listing to assist families, physicians, and service providers with locating and obtaining appropriate screening, diagnostic, and treatment services, and educating families, physicians, and service providers on the importance of newborn hearing screening and the effects of late identified hearing loss. Thanks for listening. Enjoy the rest of the Deaf Awareness Day presentations.
This is Hands and Voices. We're an organization that provides services for families with children all over the world. Hands and Voices started as a small group of parents and families with deaf and hard of hearing children or deaf and hard of hearing adults. And we started discussing how do we improve the life of a deaf and hard of hearing person in our families. So that began the mission of our group, and it just grew year after year. the group got larger and larger. It started in Colorado, and now almost every state has a chapter of Hands and Voices. Their mission is to help families and support families on their journey with deaf and hard of hearing children, giving them the support with each other, either if it's communication or their background or whatever their experiences are, that we work together to help each other. And I'm on the board of Hands and Voices for deaf and hard of hearing. And my job is to focus on this chapter and the organization. We have a newsletter that we send out, and anyone is welcome to join in using this website.
Hello, my name is Cindy Shaver. I've been a teacher for the deaf and hard of hearing in West Virginia for over 30 years. From the time I started teaching back in the early 90s until today, I've seen many changes. One of the most important ways that we can support our deaf and hard of hearing children in West Virginia is to offer options. Parents have options even before their child enters a school. They are the decision makers on what type of communication method that child will be using. Will they use ASL or listening and spoken language? Will they attend a residential program or a public school? No matter what decision the parents make, we as an educational team must respect and support their decision. This team must be comprised of many individuals, including parents, classroom teachers, speech therapists, educational interpreters, interventionists, administrators, teachers for the deaf and hard of hearing, and many others. Early intervention services are essential for student success. These highly trained professionals can help the parents navigate those uncharted waters by providing them with unbiased information in all areas of communication choice, amplification options, and school choice, all while teaching those basic skills that all children need to have when they enter school. They are a parent's closest ally in those early years. Once the child with hearing loss enters school, whether it be public, private, or residential, it's our responsibility to make sure they have full access to their education. We must provide any assistive technology, such as FM systems, captioning, and qualified educational interpreters that will allow them equal access to their learning environment. We must provide qualified professionals with an understanding of hearing loss and its impact on a child's educational growth, so that they can continuously gather data and utilize that information to allow for flexibility in a child's educational program in order to meet their unique needs. Hearing loss adds a dimension to learning that often requires explicit teaching of skills that hearing children learn incidentally. Most teachers without specialized training related to hearing loss do not have the expertise to address those unique needs. Aligning these areas of needs to our existing content standards will benefit our students and allow our highly qualified teachers of the deaf and hard of hearing to prepare them for life after high school. So you can see, deaf and hard of hearing education in West Virginia must be very diverse and fluid. We as teachers must remain flexible, continue learning about new programs and technology, but most of all, continue to focus on our students' unique needs for success so that they can become productive citizens of our state. Who knows, we could be educating a future doctor of audiology or even an engineer that will work on future space missions.
Hello, my name is Crystal Miller, and I work for the West Virginia Division of Rehabilitation Services as a program specialist for deaf and hard of hearing services. The West Virginia Division of Rehabilitation Services, or DRS, supports youth and adults with disabilities ages 14 and up on their path to work and live independently. Through our statewide field services program, consumers receive effective one-on-one personal service from DRS. DRS has specialized rehabilitation counselors that have been trained to work with individuals who are deaf and hard of hearing. DRS rehabilitation counselors carefully evaluate consumer skills, their abilities, their interests, and then provide the services and the comprehensive support each consumer needs to meet his or her employment goal. Examples of some of the services our agency can provide include vocational counseling and guidance, transitioning to life after school, training, evaluation, career exploration, accommodations such as interpreting, assistive and rehabilitation technology, hearing aids, work adjustment, life skills, employment search, job coaching, and so much more to assist our consumers. Depending on the services needed, the consumer's involvement with DRS can last several months or take several years. Follow-up services are provided by the rehabilitation counselors to assure that the consumer's employment is stable and satisfactory. To learn more about the services the West Virginia Division of Rehabilitation Services provides, please visit our website, www.wvdrs.org. I also encourage you to visit our transition website, www.pathwayswv.org, which houses a collection of information, resources, and tools to help students with disabilities through their journey from youth to adulthood. Finally, it is our mission together we enable and empower individuals with disabilities to work and live independently by providing individualized services to consumers and employers. So prepare for your future now. Thank you so much.
Hello, I'm Christopher Mick. I'm the president of the West Virginia Association for the Deaf, also known as WVAD. Our mission is to provide support and qualified living for the deaf and hard of hearing individuals of West Virginia. And it's not limited to deafblind and parents of deaf children as well. People who become deaf later in life or children of deaf parents. WVAD is a state agency, and we are under the National Association of the Deaf. We here at WVAD like to provide support for the deaf and hard of hearing of the state of West Virginia. And if you'd like to follow our Facebook page, you can see we have different activities and events planned there. And you can also check our website at www.wvad.org. And there's a lot of information included in our website, what our future plans are, and what we are advertising on our website, as well as our Facebook page. Thank you for your time and learning about WVAD. And I would look forward to seeing your support in the future.
Thank you once again for joining us for this virtual event. We hope you've enjoyed yourself and have a better understanding of some of the wonderful programs in the Mountain State. To learn more about what our commission does or to check out upcoming events, visit dhhr.wv.gov/cdhh. You can also follow us on Facebook. Our page is West Virginia Commission for the Deaf and Hard of Hearing. Thank you and be well.